Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
I'm going to have a heated discussion this morning. And I have someone who you've heard before, but he is certainly doing a very big service to our listening audience. And he has great credentials. And we're talking now with Dr. Edward WINOKUR. And he is associated, he has his own private practice, but he's associated with Broward Health North. And Dr. WINOKUR, I certainly, as a pulmonologist and a person who really understands so much about the body, especially from the waist up. But let's talk about your favorite topic in the summer, and what is that?
Well, I think this week especially, where the temperature got into the 90s, and for the first time we had heat indexes over 100, I think it's important to talk about heat stroke, which is significantly manifested as we get older.
Well, but wait, let me just stop you. I mean, the whole point of this, yes, it is a program for seniors, but I would say babies also could be let's not leave them out.
Absolutely, no. This can affect every age group. Heat stroke starts to occur when your body temperature goes over 104 degrees Fahrenheit. We know that natural temperature is about 98.6 degrees Fahrenheit, plus or minus 1 degree. But if your temperature starts going over 104 degrees, and it is not due to an infection or a fever which is caused by some other medical condition, we are starting to get into the realm of heat stroke. Now, body heat is generated by both the metabolic processes of daily life and absorption of heat from the environment. The nervous system recognizes excess heat, and in response to this increased heat, produces sweating, dilation of your blood vessels where you can get pink in the face, and you start with evaporation of the sweat, which is the main mechanism of heat loss.
Now, Dr. WINOKUR, I'm just going to stop you a minute because we do have some people watching you now also, so you need to look into the camera also. But let me also say that typically, heat stroke, you're walking along, right, and you're in the sun or you're whatever, and all of a sudden, what's the first thing that you feel? What happens to you? Like, what should someone say? Uh-oh, I've got a problem.
The list of symptoms is quite long. It can range anywhere from, gee, I just don't feel well, I'm starting to feel a little bit lightheaded, to the ultimate symptom, which would be coma. And it can be anything, because the increase in temperature can affect every organ system in the body. You can have respiratory symptoms, you can have neurologic symptoms, weakness, nausea, dizziness, slurred speech, agitation, or as I said, you can actually have seizures, delirium, or in the ultimate, coma.
Okay, so now I'm walking along and all of a sudden I'm feeling nauseous or something. I know I have to get out of the heat, right? And then what should I do fast?
If you have somebody with you and your mental condition starts to change, the other person, and this is why it's important for the community to be able to recognize somebody who is having heat stroke, it is imperative to start lowering the body weight, the body temperature, I apologize. There are 3 ways that the body loses temperature. One is with radiation, and you will know radiation, especially if you are a husband married to a woman who went through the change of life. There you are at night, all of a sudden the hot flash occurs, the wife gets really hot, the blankets go on, the blankets go off, but you can actually feel the heat radiate from the body. This is one of the neurologic system's way of dissipating heat. Another way is by conduction. Get the person out of the hot environment into a cooler environment. And the third is convection. This is where if you can bathe the body in temperature about 60-degree water,
So in other words, jump into a shower.
a 60-degree cool shower, or even more effective if you can spray the body with water and put them in fans. And that way, that will actually help to dissipate the heat.
Climb into
even
my
faster.
refrigerator, right?
Well, open the doors and wave it back and forth, as we've been told not to do by our parents for many, many years. Absolutely.
But what about ice? Let's say I can get some ice. What do I want to do with that?
Ice can cause significant constriction of the blood vessels and slow the blood circulation down. If you're going to use ice packs, usually putting them in the axillary region, the armpit, or down in the groin seems to work the best because there is adequate blood flow and it is not overwhelming. But the most important thing to do is to recognize the symptoms. And if you are out in the community, you see somebody who is stumbling and you feel, oh my gosh, you are burning up, take it under advice that this is probably something that must be
Call 911.
Call 911, because the best way of dealing with this in the hospital.
Well, maybe what we should do is let's prevent it from happening. So you talked before the show, instead of wearing black, wear white. Let's talk about what I should do to prevent this even happening.
I think it is important to realize what some of the causes of heat stroke are, and that is environmental. One of the things that we talked about is there are two clinical subtypes of heat stroke, and you just mentioned one of them. The most common heat stroke that we see is in the young people, in the military, people who are in sports, people who overexert themselves, and this is called exertional heat stroke. You are exerting yourself in a bad environment of too much heat, and more important, too much humidity, and that is what induces the heat stroke. The second subtype is called the classic heat stroke, and this is what we see in the elderly, especially over 70 years of age. It's magnified in the elderly because their skin loses its effectiveness to transfer heat. They lose the subcutaneous fat under their skin, the skin gets thinner, and the nervous system does not react as quickly to the heat changes. There are also certain clinical conditions, or what we call comorbidities, that in itself increase the risk of heat stroke. Things like heart disease.
Well, let's just talk about people taking high blood pressure medicine.
Especially beta blockers and diuretics, which are water pills, which will have a tendency to possibly dehydrate you, make you at a much higher risk for developing.
Let me just tell everybody you're listening. This is a fantastic explanation and program that Dr. Edward WINOKUR has brought to us this morning. I hope that you're taking notes. If not, you can locate him. He has private practice in Pompano, Deerfield Beach, and he's associated with the Broward Health North hospital. But I'm really happy. It's funny, I was telling him before when he said this is what he wants as the topic, that I haven't had this. No one has talked about this, and I'm asked him really if he would write an article for us, because we hear the words heat stroke, but I've never had it myself, and I'm sure that you've had patients that you've seen with this. And then I wanted to ask you, and I know you have a lot more to talk about, is there, if you've had heat stroke and it's taken care of, is this something that can do damage to your body afterwards?
Absolutely. The worst case of heat stroke is if your core temperature raises to 108 degrees. If you ever hit 108 degrees, your body shuts down. None of your organs work at 108 degrees. None of your enzymes work at 108 degrees, and you can develop end-stage respiratory disease called ARDS, disseminated intravascular coagulation, where your blood just starts clotting on its own, kidney failure, liver failure, your sugar drops to a low point where you could actually pass out, and the morbidity and mortality just goes up tremendously.
This is very frightening, Dr. WINOKUR.
It is. The risk factors go up with increasing age. They did a study comparing, as we said, the exertional heat stroke of the young versus classical heat stroke of the elderly, and the death rate goes from 21% up to 63%. And those are really tough statistics.
Okay, so this is what I'm suggesting. Let's see what you think. People want to exercise, and hopefully, fortunately, they do have air-conditioned exercise rooms in their condominium. But instead of going out and exercising, they should go to the air-conditioned malls. If they want to walk, go into a mall and walk, right? Or exercise in their apartment with cool air. I just, this is a very frightening thing because I didn't realize how serious it was. And of course, we look around the world and we're listening to the poor immigrants who are having to come across thousands of miles in the heat. And so that's why I think we're seeing deaths and a lot of illness. But I think the most important thing, here we are in South Florida, it's only June and the temperatures are rising.
Heat stroke is directly related to not only the ambient temperature, but the humidity as well. Because the heat index, which is actually the temperature your body feels, is a combination of the temperature and the percent humidity. Now, the humidity becomes a problem when it starts getting over 65 to 75%. And in Florida, that's basically any day that ends in Y.
Yeah.
We are known for our humidity, and that's why it is so important. And I can't stress enough for the community to be aware of the signs and symptoms of heat stroke, so that if they do see somebody who starts to demonstrate the symptoms, they can act as almost a first responder. They can help call 911. They can actually then also start to do some of the things to induce rapid cooling and decrease the morbidity and mortality. I'll leave Charlie here. Charlie's doing fine.
No, he's barking. No, he won't. That's okay. I'm going to take care of him. I haven't had this problem. Charlie is very quiet usually, but we're going to, because I don't want to lose any of this for you, but maybe it's a good time to talk about dogs in the heat, because you have a dog also.
Absolutely. All right, so take what we have, and we are smart enough. We can put on nice white linen or something that will actually reflect the heat. But if you have a dog who's got a black coat, black absorbs the heat. And much like we recommend, you do not exercise in anything with black. And for your dog as well, make sure that they are well hydrated and watch out for their dog pads, because the cement becomes even hotter as it absorbs the heat, and they can burn their pads. So we were talking, heat stroke is also higher incidence in people who have diabetes, are on certain drugs, and we talked about the water pills, we talked about beta blockers, but also alcohol. Alcohol will actually make you more prone towards heat stroke. So sitting by the pool in 100-degree weather with 110 degree heat index and say, oh, sure, go ahead and give me a couple more margaritas.
Oh, boy.
You know, that's like a typical Friday and Saturday in Florida, but man, that is just opening the door to heat stroke. So we have to be careful about what we wear, what we eat, what we do. And as you appropriately said, hydration. Make sure we keep our fluids up.
Okay, so now let's talk about food. I happen to love watermelon. And watermelon, of course, thank goodness, that's the time of year in the summer. So if I eat a lot of watermelon, there's my water. And so fruit would probably be a good thing for you to eat in the summer, wouldn't it?
There is nothing better than water. Because as we sweat, and sweat, as we talked about, is one of the way of dissipating heat, you are losing a lot of electrolytes and waters. And although watermelon and fruit are good, it does not replace water. You ask, what do we do when we call 911?
Yes.
The patient is immediately transferred to the hospital. And they took a lesson from our mothers in that the best way to monitor the temperature, and the only way, is to monitor what they call the core temperature. And unfortunately, that is not looking in the ear or sticking a thermometer in the nose. It's what Mama used to do. And just think about the popsicle and the stick. The thermometer is the stick, and you've got to do rectal temperatures. That's the only way to follow the core temperature, because the goal is to get the core temperature down to about 102 degrees. Now you're almost in the safe range. But when you're 104, 106, or 108 degrees, now you're in the true danger zone, and it is imperative to start very, very aggressive treatment.
But you see, that's something you as a physician will do. But for us at home to take temperatures and all, we will know from some of the response you said about being nauseous or, feeling faint or all that. You should really wait for that. You should just, I would like everybody to start thinking about what their day is like. So let them get up early in the morning if they're going to go out, but don't go out after maybe 9 o'clock, because I think that's when the heat starts, doesn't it? And then wait until 5 o'clock at night to when the sun is not as hot.
Listen to the weather report. Our weathermen are very, very good at telling you what the heat is and what the heat index. And if you're noticing a heat index near 100 degrees, don't go outside and exercise. We know that age, dehydration, obesity, poor physical conditioning, social isolation, and lack of air conditioning put you at a higher risk for a heat stroke. So be aware. Know what your surroundings is and know about your neighbors. Help take care of our community. If you find somebody who you think is having a heat stroke, there are a couple of things we should do in the community. Number one, within 30 minutes, the patient can get into trouble. They could start having organ failure. So it is imperative that we do something within 30 minutes, even in the community. Number one, remove all excess clothing and check their airways, their breathing, and their circulation. Make sure their pulse is doing okay. Remember, we said one of the number one sentinel signs is a rapid heart rate and rapid breathing. So if somebody is very warm and you're noticing these, they're in trouble.
Call 911, right?
Try and get them cool. Get them in an ice water bath, as you said, and keep the head and the neck elevated. Keep as hydrated. That's where you want to get the water, around those areas. Because when you get hot, the blood has a tendency to circulate to the organs to try and protect the organs, and they go away from the skin. So you lose your ability to cool. So keep the skin as chilled as you can.
And I was joking with you about this, but if you're in the house, just open the refrigerator door and put your head into the refrigerator. I don't mean shut the door on your face, but I mean, that's a pretty cool air there, isn't it?
Absolutely, and jump in the shower. Don't turn it on hot. Turn it on cool.
Oh, yeah, absolutely.
60-degree temperature water is the best temperature to help lower the body temperature.
And if you're feeling this way, don't go into the shower by yourself either, because that's a way that you could fall. Make sure someone's there with you.
Absolutely.
Right?
This should be done. And a lot of times, the mental status changes are pronounced. As I said, you can get anywhere from I'm a little dizzy, I'm a little lightheaded, to people going into frank delirium and coma as the temperature goes up and the organs start to fail. Try and have somebody monitor the vital signs. Watch the pulse rate. Watch the breathing, because if any of those stop, we're in danger.
Well, I want to keep doing this because I have all these things that happen. So you said before that someone could be living in a place without air conditioning, and I guess a lot of us are very spoiled. We don't understand that. Let's say someone doesn't have air conditioning. They better have a fan, right? And you said something about having maybe cool water, maybe having water or ice, something where the fan does something to push that, right?
If you can get a spray bottle of cool water and just spray yourself down with cool water and sit in front of a fan, that helps tremendously lowering. It acts like a radiator in that the coolness going over the water helps you to radiate off the temperature.
That's very clever. I never thought about that, but because I guess I'm spoiled because I have air conditioning, but there are people, a lot of us, all of a sudden our air conditioning our air conditioner breaks. And we're without air conditioning, and they can't come often within an hour. It might be 4 or 5 hours. So you better have maybe an extra fan, just thinking about these things, in your home. Just a small fan somewhere, right?
Correct.
Just in case.
And a spray bottle. And if you're planning on going to the beach to bake yourself for some unknown
please
reason,
don't do that.
take a spray bottle of cool water with you and spray yourself off again, so it acts almost to help you dissipate the heat in a radiant
But you
fashion.
could jump. Can't you jump into the ocean even though it's warm? It's still. Wouldn't that be okay?
It's remarkable how many people go to the beach and they don't want to wash off their suntan lotion and stuff, and they will get into trouble.
Right, but if they go into the water,
Cool off,
that will
absolutely.
cool
You
you.
must be very cognizant of all of a sudden you start noticing that you're sweating to excess. Yes, you've got to be able to replenish the water and cool off. Or if in the community you notice somebody who hasn't moved for a while on the beach and they're sweating,
Oh my
and
goodness.
it is imperative for us and our neighbors to take care of each other. And as you said, the people who are socially isolated, who don't have air conditioning, please take a minute, go over and check on your neighbors, make sure they're doing okay, and be aware of the symptoms that we talked about so that we can help our neighbors from getting into the incidents. Because once you get into the point where you have to go to the hospital, now you're on intravenous fluids to replenish, and it becomes a emergent nightmare.
now have you seen a lot of people with heat stroke? Is that something that's very common in your world?
Yes, it usually starts around this time of year where the heat index goes up to 100 and gets worse through July and August. Starts to get a little bit better through September and October.
Okay, let's talk about though. Let's go back to some of the medicines and the things that people find themselves in. Maybe they're more apt to have this problem. So if someone's on blood pressure medicine, or they're diabetic, or what are some of the instances where they're more susceptible to this?
One of the problems that we see in a younger population is cocaine abuse. Cocaine is one of the medications which leads to heat stroke. Beta blockers, which are used anything for blood pressure to heart disease, and water pills or diuretics, which are used for anything from edema to heart failure, put people at a very, very high risk. Alcohol, you actually lose fluid with alcohol, and your nervous system loses its ability to react to elevated temperature problems. Psychiatric diseases and psychiatric medications, again, working on the brain. It's the brain that actually helps us to recognize and the body to react to high temperatures. So neurologic diseases and psychiatric diseases are also some of the common comorbidities that increase our risk for complications from heat stroke.
I really have to thank you for taking this topic on, and we only have about a minute or two left, but I am very thrilled to help people before. We call it prevention, and you've talked about a lot of the problems after, but the prevention is the biggest thing. What can you do as a takeaway for people?
One important point is everybody says, oh, go take some Tylenol, take some ibuprofen, take an anti-inflammatory. Those have actually been shown to make heat stroke worse. So I would like people to realize, do not dally. Do not wait to see if Tylenol can worse. It can actually make kidney failure worse. It can make muscles worse. Get help. As we said, try and cool the temperature down as much as you can in anticipation of 911 coming. Make sure that you have a good list of medications and medical issues associated with the person, and then let the specialist deal with continuing to following the core temperature to get that temperature down to 102 as fast as possible. And then once they hit 102 degrees, we can be slower and more conservative in the treatment, and they're out of the woods.
Dr. WINOKUR, it's been wonderful having you here this morning. I can't thank you enough. What I want to do is also give, and I don't have that, but what is your own number if someone wanted to reach you? Is it the 954-933-9600?
600. Yes, that's the direct number to my office. If anybody has any questions, please feel free to call. But this is something that the community must be getting involved with. We must recognize our neighbors who are in trouble and know how to help.
Thank you. Well, you've been a wonderful help this morning, and we look forward to an article from you. Hopefully we'll get in July, if not in August. But thank you again, and stay out of the sun, everybody.
Be careful.